everyone, and thank you for joining us for the Virtual Canada Health Infoway Partnership Series. I'm Suhanna Marchand. We do have attendees participating from across Canada and around the globe. And allow me to take these initial moments together to acknowledge that the lands on which we are hosting this event include the traditional territories of many nations. Canada Health Infoway recognizes that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and well-being. Canada Health Infoway respects that Indigenous people have rich cultural and traditional practices that have been known to improve health outcomes. I invite all attendees to reflect on the territories you are calling in from as we commit ourselves to gaining knowledge, forging a new, culturally safe relationship, and contributing to reconciliation. As a journalist, I have the privilege of covering national and international stories, interviewing newsmakers from around the world, and healthcare, as you can well imagine, is always an important story. How we deliver it, how we access it, how we improve the system to attain better health. So I'm thrilled to be your MC for this event. I do have a few points, however, to cover before I introduce our first session, because I know you're anxious to get going with that. We have simultaneous interpretation available for all Infoway Partnership Series sessions. So to listen to the session in French, please just follow the instructions on the screen. We also have closed captioning services available. To enable English closed captioning, simply select that CC button on the bottom right of your video player. The Virtual Infoway Partnership Series is proud to be patients included. Infoway is pleased to continue to convene events which adhere to the accreditation. In collaboration with its patient partners, Infoway has developed the Patient Family Caregiver Recognition and Inclusion Statement. And this statement really acknowledges the critical role of patients and families and caregivers and underscores its commitment to collaborate with them as we all work toward improving the health system. The statement reads, and just give me a moment here, we recognize the unwavering commitment and essential impact patients, families, and caregivers have and will always have on the Canadian healthcare system. Canada Health Infoway pledges to continuously listen to the perspectives and learn from the lived experiences of patients, families, and caregivers to ensure respectful collaboration in the work we do and influence. We look forward to building true partnerships and acknowledging shared successes. The patient advisor for this September 21st partnership series is Ron Bellino. Ron has been an advisor for the overall program development. So a sincere thank you, Ron, from the team at Canada Health Infoway for your incredible support. And today I should also mention, has special significance for Ron, who is an advocate for those living with dementia and Alzheimer's disease. Why? Because today, September 21st, happens to be World Alzheimer's Day, a day to raise awareness and education about Alzheimer's and dementia. It's also a day where we acknowledge and recognize the 50 million people living with dementia and all of the caregivers as well who support them. Today's session around innovation is one way we can all make an impact on the dementia community and many of the other health communities as well out there. So thank you to Ron and the others who continue to bring awareness to Alzheimer's and dementia every day. Now, at the conclusion of today's broadcast, we'd really urge you to share your event feedback, and you can find the survey at the right side of the screen. We also welcome you to engage with your fellow event attendees in the platform chat. And you can find the chat. It's easy. Just click on that blue talk bubble icon at the bottom right-hand corner of the screen. And that chat can be used to share your comments with all attendees or to message specific attendees directly. Now, that time you've been waiting for. Let's get right to the program. We're going to kick off with the first presentation, Continuous Innovation in Healthcare. Mario Voltolina, the Executive Vice President of Innovative Technologies at Infoway, will join us on the virtual stage. So Mario, I will pass it on over to you.
Thank you. Those are the slides. First of all, again, welcome. Thank you for coming. I think we have a great program for you today, and hopefully you will agree when you fill out the survey at the end. How we share tips is dependent on that survey. One of the things that, let's see if we have more technological problems. No. The clicker works. So first of all, Infoway recognizes that there is a lot of innovation that's happening in Canada. Also, the word innovation has perhaps become overused in everyday vocabulary, but we'll keep using it anyway. We know that there are many organizations, individuals, groups that are doing work in innovation in healthcare in Canada. And Infoway has decided to step up and help. And just under a year ago, we created this group called Innovative Technologies. And the intention for this group is to actually support these activities. It is not about doing R&D or technological development. It's for bringing people together who are already doing it and helping them succeed and share the wins, and in some cases, the losses that will become learning experiences. In order to do that, one of the first things that we had to do, of course, is come up with a name, and we came up with the name Chic, which stands for the Canadian Healthcare Innovation Community. Although every time I hear or say the word chic, the song Good Times plays in my mind. Anyway, the idea is that the community actually involves everybody. It involves the scientists, it involves the patients, it involves the clinicians that actually make use of the technology. It involves the regulators, it involves the funders. And one of the things that we really want to do is make sure that everybody is involved and moving forward together. That's, I think, the only way that we're going to make real impactful differences in our healthcare system, by getting everybody involved. So again, Chic is you, everybody who's attending today, and so many of the people who couldn't make it today as well. It's all a part of that large community. In order to coordinate things a little bit out, we came up with what we're calling the Continuous Innovation Framework. And this is really a framework oriented towards collaboration and coordination. We're calling it assisted coordination among the Canadian healthcare community. It's intended to take some of the research and development, move it through adoption, move it through procurement processes, and so on in a coordinated way, because in order to actually achieve the outcomes that we're trying to achieve in the healthcare system, we need to act together. It's really as simple as that. And this framework, we think, fits well with Infoway. Infoway now has a history of relationships across the country. Infoway has a national view, and we are now developing new relationships with groups that were not necessarily part of the Infoway family before. The framework itself has three main phases. The first phase is continuous foresight. Continuous foresight is about identifying what is out there, be it a technological innovation, a process innovation, a trend, or some other type of impact, identifying how meaningful it is, and forecasting the impact that it's going to have. And we'll come back just briefly to the continuous foresight part. The second component is really innovation convening. Really is about bringing groups together to discuss, plan, and execute on what matters as determined by the community through the continuous foresight process. This is where we share the knowledge of the how we improve the processes of the framework itself and of the things that we're all working on in terms of adopting or discovering some of these technologies and learning from shared experience. Again, there's so much going on in the country that is in pockets, that isn't visible from other parts of the country, and this is really intended to shine light on it and bring everybody's knowledge together, but also to decide how to execute on some of these elements as a community together. And the final part is really, it's about measuring the impact that we're having. This is the old saying, if you can't measure it, you can't manage it. It's probably not entirely true, but it is important for us to measure what we're achieving and to feed it back into the loop to improve our forecasting, our identification, and our planning and our execution. So again, the innovation measurement part of the framework is really important. And I'm sure you're all fully aware of the quadruple aim, even though it's not an official thing as an expansion of the triple aim. But we think it's really important to align what we do to improve the patient experience. Navigating the healthcare system can be really difficult for certain groups. It can be difficult for me as well. I mean, sometimes it's really confusing. It's important to improve that experience. Of course, it's important to improve outcomes. And by outcomes, we mean things like improve mortality, improve treatments, and so on, improve quality of life. It's also important to lower costs, or at least contain costs. We hear all the time how expensive and how much money goes towards healthcare. It's really important to use some of these innovations and advances to actually contain those costs and to be able to afford the future. And And of course, improving the clinical experience. Even before COVID, we know that a lot of the clinicians and providers were tired, were overworked, were having a hard time, and COVID has only made it so much worse. So it's really important as part of our aims that we improve that experience through, again, the application of innovation. We want to improve the workflows. We want to improve the output as well, and that's going to be done through that provider experience. So going back to continuous foresight a moment, and continuous foresight is really about identifying the technological innovations, identifying the driving forces, melding them together with what's actually happening in the delivery of care. And one of the critical parts of continuous foresight is forecasting, and forecasting with greater accuracy both the time horizons of when things will become real and implementable, as well as the outcomes, so that we can use those to actually identify what we want to focus on and push on. And we are looking at the wisdom of the crowd. We believe that diverse points of view, diverse roles are really important in actually estimating the outcomes that will be the result of some of these innovations as they get implemented. Now, we didn't actually pull this framework out of the air. We actually spent a fair amount of time with people at Gartner and at ThoughtWorks to see how they do their innovation scans and sort of collection of information. We worked with a Cloud Native Computing Foundation, of which Infoway is a member, to look at their community management piece. And we looked at Good Judgment, which was a offshoot from a project from the University of Pennsylvania to improve the accuracy of forecasts. And finally, the framework that we've put together is designed for Six Sigma. We really want to make sure that it's something that a lot of people can work with and be aware of. One thing that we're going to be publishing soon on the Infoway website is called the Infoway Radar, and it's a graphical representation of what the community has determined to be in the coming down the line in terms of an innovation or a trend. And this will be kept up to date. It'll be the output of the continuous foresight process, and it's something that the whole community can contribute to and can also go and visit and see what the community thinks is happening and needs to work on. I really want to thank our web team for actually putting in what I thought was the most important requirement, which is the animation of the radar sweep that actually goes around the screen. Absolutely fabulous. We also have an example ready to go out the door very shortly around convening activities. And it is about the adoption of AI. This is primarily aimed at places that are not sort of advanced AI institution, academic centers, but for a lot of other parts of the community that can be positively impacted by AI. So it has 6 modules. One is, what is AI and what's it good for? I know it's sort of set to ground everybody in a common understanding of what is achievable using AI, an identification of the key risks, an overview of the regulatory landscape because it's a little bit different everywhere, identifying strategic opportunities, change management, an actual governance framework that people can take with a set of templates and implement. And we're going to be publishing this. We're going to be running a whole bunch of webinars and collecting feedback. And hopefully, again, the community will come together to help us make it better and actually adopt it as something to do. Almost finally, this says do something great, but it really should say keep doing something great, because there really is so much fantastic work that's going on across the country, and we really just want to help coordinate it, make it impactful, and just keep doing what you're doing. But at the same time, would like you to let us know that you are interested in participating in Chic, particularly right now in the continuous foresight process, identifying what's coming down the line, forecasting the results. And you'll see a screen on your, you'll see a link on your screen. You'll also see it in the chat, and it'll be part of our post-conference package. Please click on the link, tell us who you are. There are so many different roles that don't necessarily require huge time commitments, but are really important. There are also some leadership roles that would require more time commitments, but we will let you know all of that. Anyway, I think we're out of time, so I'm going to give myself the temporary hook, and let's move on to the next phase.
Thank you so much for that, Mario. And I'm going to ask you not to go anywhere because we still need you. We do have a jam-packed panel discussion that is coming up next around the integration and acceleration of digital health innovation. So I would like to welcome Simon Kennedy, the Deputy Minister at Innovation, Science and Economic Development Canada, Arunka Anima, Director of Science and Innovation at KPMG, Michael Green, President and CEO of Infoway, and your moderator for today's panel will be Mario. So once again, over to you, Mario.
I guess I didn't go too far. I'm just going to, because we're running late already, I'm just going to give a very brief introduction to the discussion. So during the summer, Canada Health Infoway commissioned a study to look at the innovation landscape in Canada in healthcare. That study has concluded. We're putting the finishing touches on the final document, which will be shared with the participants, and we're also building a summary which will be shared with the whole community. That particular study involved interviews with about almost 50 different organizations across the country of all different types, but all involved with innovation in healthcare. And even though we haven't published the document yet, we're going to talk about it anyway, because why not? It's a really interesting topic. So that was the quick introduction to this piece. And now I'm going to start with the panel. I'm going to start with you, Aranka. Now, you were a key participant in this. You also have seen over the past 18 months some of the changes that COVID has brought to innovation in healthcare in Canada. And I'm going to kick it off with you by asking you, what are your thoughts?
Great, thank you, Mario. And hello to everyone on the line. Thank you for joining today. So I think when we're talking about innovation, as Mario already indicated, it's such an ambiguous and nebulous concept. It's important for us to, I think, frame what we're talking about and at least try to define it to some extent. Theorists in the past have tried to come up with definitions that tend to focus on the generation of new ideas or processes or technologies, or the application of existing ones into new contexts. Innovation often also brings up notions of commercialization, scale of new processes and services, but it's not necessarily the case that an innovation has to be a new form of technology. Many of you may recall the 2015 Naylor report, Unleashing Innovation, which intentionally sought to develop a strategic and operational definition of innovation for healthcare in Canada. And that one, I think, was really quite good. It emphasized the focus on quality of care, safety of care, providing value for patients and providers, creating efficiencies, both operational and administrative, and also really focusing on unmet needs and on achieving both economic and social impacts. Certainly in the course of these interviews that we carried out with a broad spectrum of stakeholders within healthcare, we included regional, provincial, federal governments, industry associations, acute care hospitals, innovation hubs and accelerators, and incubators. And we noted an ongoing trend whereby conversation around innovation seemed to focus on this of research and development as it then pertains to the discovery of innovations, and then innovation being the actual commercialization, scale, or implementation of a given new digital or health technology or process. Certainly what we're seeing generally in terms of a trend in healthcare, I would say globally, but in Canada for sure, is that healthcare is moving away from hospitals and primary care and towards the home, towards alternative locations such as pharmacies, certainly towards our phone. More and more, our telephones are becoming the locus of healthcare delivery, both for detection as well as provision of care. Really, there's an expectation among consumers, just in the same way that we can be procuring any product that we want to purchase online, that we're able to procure the same efficiencies in healthcare. We can turn to our healthcare provider to ask questions about what type of app can I use? What type of wearable device can I possibly use that can improve my own monitoring of my behavior or of my health in general? There's an assumption among consumers and citizens that healthcare is going to be from being reactive to being more proactive, and also from we're expected from prevention to prediction, if you will. And a lot of this is really being spurred by the quantified self movement, whereby wearable devices, medical grade wearables, are allowing us to things like heart rate, oxygenation, glucose, pardon me, electrolytes, our sleep behavior, our physical behavior, in ways that have really been completely unprecedented before, allowing us to be essentially our own advocates for healthcare, as well as allowing people to be extremely proactive in their own care. So the informed patient, again, is really turning to their healthcare provider for further advice. And this is only going to complicate things further as we start to see the broad-based uptake of things like genomic data and microbiome data, which are now becoming available to consumers. So when we talk about where healthcare innovation in Canada is going now, from my perspective, I really see it as a convergence of different services, digital technologies in a way that needs to meaningfully integrate with existing clinical workflows. And what I mean by that is if you have an individual that comes with 101 wearable devices, they're coming with their own big data set that they're assuming and hoping will be integrated into their electronic medical records. So the question, of course, from the health systems perspective is how can we possibly enable that? We are unfortunately still many steps behind in terms of achieving that goal. There are initiatives such as Google Health and NIH that are starting to experiment with this. But certainly we're still in an age where in Canada, many hospitals continue to use paper-based records, continue to use fax machines. COVID has indeed been a major catalyst. I think we've all benefited from this. No one wants to take 2 hours out of their day to go see a clinician. We expect a 10-minute phone call or FaceTime or a Zoom video. And we've seen tremendous examples of that across Canada in terms of how healthcare organizations have leveraged the silver lining in COVID.
And thanks, Saranka. That's fabulous. I'm going to ask Simon, because he's had he is in a unique position, having been the Deputy Minister for Health Canada, currently the Deputy Minister for Innovation, Science and Economic Development. So Simon, over to you. What's your perspective of sort of technology or technical innovation in Canada in healthcare?
Thanks for the invitation to be here today. Maybe I'll use Saranka's comments as a bit of a jumping off point because I generally agree with them. You can look at the definition of innovation in a number of different ways. And I think in some respects we at least my experience is we have issues with innovation in the Canadian healthcare system, and in other respects we don't. You can look at innovation in terms of the development of new technologies and new services and new products and kind of doing things in radically different ways to improve patient outcomes. And I think you can make a case that there's plenty of innovation going on in the healthcare system if you look at that metric. And we could just use the pandemic, the experience of the pandemic, as evidence of that. I mean, there has been, just awe-inspiring innovation in the development of vaccines under very short timelines. And Canada is now actually a world leader in delivering vaccine doses to its population. So, governments in this country, our healthcare system, has been able to, pick up that innovation, deploy it. And I could use, new class of drugs for hepatitis C. I mean, the application of all sorts of new technologies like CAR T, therapy and so on. So I'm using a variety of, pharmaceutical references, but the point being that, there is cutting edge innovation going on, and, and there are, that technology is employed in Canada. It's not as if we're not using some of these advanced technologies. And when I was at Health Canada, we did spend a lot of time thinking about the pace of innovation and how to start to adjust the regulatory system and our role as a regulator so that we would be in a better position to kind of support innovation in the healthcare system and to regulate it and to make sure that those innovations were being used, safely and effectively. For example, the government agreed to support the creation of a new group in the department that dealt with digital health technologies, which, as everyone knows, have become very important. So, is our innovation problem that there isn't a lot of creative ideas out there and a lot of new technology? I think the answer to that is no. There is an issue around the speed with which the Canadian healthcare system adopts new technologies, and not just technologies, but also kind of business process improvements and other kinds of innovations to deliver better care more efficiently to the patient. And there's been a lot of ink spilled on why that is. David Naylor certainly wrote about that in his report. And my own personal sense is that some of those issues are really, those are not kind of technology, related issues. It's really kind of a management challenge, which is, do we have the right kinds of incentive structures set up in the healthcare system to actually, uptake innovation, rapidly integrate it, and find ways to use that innovation to actually get better outcomes? Like if you think of a manufacturing operation making automobiles or something, and the company decides to put in advanced technologies like robotics and so on, they usually do that. They usually do that to produce vehicles, better vehicles at a lower price, and be more efficient as a factory. They integrate the technology in a way that actually kind of lines up with a whole bunch of other process improvements to kind of get a better outcome. And I think you can make a case that in the Canadian healthcare system, it's difficult sometimes to adopt those kinds of innovations and organize care to actually maximize the results. So to give you one example, I'm aware of one case, we talked about it a lot when I was at Health Canada, in which there was a technology that had actually been championed by a bunch of physicians. We're really kind of forward-looking, and we're quite keen to bring this technology to bear because it would improve patient outcomes and so on. But actually, once the technology was adopted, the physicians actually found that it made their own situation worse off because patients were kind of shifting to the new technology, which actually resulted in like less remuneration for them as physicians. So great for the patient, more convenient, not so good for the I'm getting a little bit of feedback. Someone's talking in my headset while I'm busy talking. Maybe they could stop. That's an example of a technological innovation that hasn't quite come to market yet. Just to say that, if you don't get the fee codes right, if you're not able to reorganize care in the way that's most efficient, then the technology, is maybe gonna be of limited impact. And I certainly saw that again in my role at health. For example, drug plan administrators are typically kind of a different part of the healthcare system from the folks who run the hospitals, and they're a different part of the system from obviously from the physicians who are providing physician services. And so you might have a new pharmaceutical which actually lowers kind of costs in the rest of the healthcare system because there's fewer hospital admissions. But if you're the drug plan administrator, that's not really relevant because you're actually not able to capture the costs because you're not in charge of the hospitals. And so the way care is organized can have a significant implication on uptake and adoption of tech. And I think in Canada, that is part of the issue, which leads me to my last point, which is if you kind of take this issue of like developing new technology and adopting new technology, I think that is, and I hear this a lot from kind of smaller Canadian, healthcare innovators, this is a challenge that we have. So we actually have lots of, really dynamic, startups and others, small firms that actually have developed cool new technology. And the challenge for them to scale it is actually the ability to actually get customers locally. And as any theorist knows, I mean, there's a lot of economic, kind of theory on this, but actually having demanding customers nearby that actually push you to improve your products, buy your products, help you to kind of get your start is actually pretty important. And the evidence would suggest, and certainly anecdotal evidence that I see regularly, is that you get a lot of great ideas, but because of this challenge of like, how do we adopt this technology into the system, a lot of these companies wind up going to another market that has, where the market's more easily able to uptake that technology. And once it's proven out somewhere else, then they kind of can return triumphantly to Canada and have it adopted. But, so there is an issue about whether we have an ecosystem that actually allows, an entrepreneur to come up with an idea, start to scale up a company, be successful in Canada, and then take it abroad. And you could ask a question, is that because we don't have enough good ideas? I would say the answer is no. There's lots of great ideas in healthcare. The issue is, are we organized to deploy them as rapidly and as effectively as possible? And I would say that that's the central challenge. We spend about 10% of GDP, something like that. I think Michael would have the latest figures, but it's like one of every $10 circulating in the economy can trace its way back to healthcare somewhere. So that's a pretty big chunk of economic activity. It's not as if we're not investing in this space. The question is whether we're investing in ways that actually kind of support the adoption of great new ideas rapidly. And the evidence on that suggests that maybe we could do better.
Well, thanks, Simon. That's great. And Michael, you've been on the sales side, on the R&D side, and now with Infoway, you've been trying to push adoption of some of these technologies. Where's your mind at in terms of innovation in Canada?
I think that we're in probably a great area of opportunity because certainly healthcare is on the top of the headlines every day with COVID. And, we all know that we're still undergoing the pandemic. The health services across the country are greatly stressed. And just throwing money at it isn't going to solve the problem, even if we had the amount of money to throw at it. And Simon's quite right. Canada stands about 11% of GDP, so it's one of the higher end of countries in terms of spend on healthcare, but with some of the outcomes which are down at the kind of lower end. So I think innovation is a core thing, but it's targeting it. And certainly we've seen during the pandemic, specifically in the area of digital health, areas like e-mental health have really kind of accelerated adoption. And a number of Canadian companies have come up, Canadian innovators have come up with technology in these fields. We're also now seeing large international or national companies such as Shoppers Drug Mart, the Western Group, and TELUS, McKesson, and so on, moving into the healthcare sector, particularly in the consumer area. And we're really on the kind of verge of empowering the consumer with new digital tools to help manage their health. So I think there's an awful lot of opportunities. The key thing is picking the right ones. And certainly one of the things we have also seen in the past, that where the federal government, the provinces and territories put a particular focus on a specific area, whether it's wait times, whether it's improving access to certain technologies and so on, you need funding to go in there. And, certainly we need the funding to kind of help spur the innovation. The final thing is, I think we also should really recognize that, healthcare is a kind of great economic, has got great economic potential. The jobs in healthcare are kind of high paid, high skilled jobs. I think that more can be done by the institutions to focus on developing healthcare as a potential market rather than some of the old stables like natural resources and the auto industry and so on, which we know are kind of plateauing out.
Thanks a lot, Michael. Aranka, you led many of the interviews for the innovation scan that was performed over the summer. What did you hear from the people you spoke with or listened to?
Sure. So a lot of what we wanted to capture qualitatively was really how organizations are engaging in innovation. And this really brought us to starting to think around innovation strategies. Typically, when people think of innovation, they think of disruptive innovation or radical innovation, whether it's a 3-person startup that is going to completely overthrow an established Fortune 500 company, or whether it's the advent of an entirely new therapeutic device. However, certainly what we've seen across Canada is there are probably 3 main categories of types of innovation or innovation strategies that we've been seeing. One is continuous innovation or incremental innovation. So innovation by doing, whereby organizations are repeatedly building upon their successes, experimenting, seeing what works, with an effort to improve patient outcomes, improve the patient experience, improve the provider experience. We have a lot of great examples of that, whether it's Eastern Health, for example, that's identifying cath labs as being a major need, access to cath labs through a hacking event. Slowly and iteratively, they started to build out a digital web-based cath lab referral system that has now led them into the development of very sophisticated innovation operational strategy that includes having created a living lab for Atlantic Canada. Other examples are Baycrest, for example, that started providing home-based care, and now over time have developed an incredibly sophisticated system for going into a patient's home, working closely with their patient and provider to understand what their needs are: functional, medical, psychosocial, emotional, etc., and then tailoring services specifically for them, and also tailoring different types of technologies that can be used to address their specific needs. By leveraging partnership with Best Buy, for example, they're able to be vendor agnostic and truly identify technologies as they're emerging. So, and in so doing, continually innovating in terms of the types of products and services they're providing. Another form of innovation that we have been seeing across Canada is structured innovation. Structured innovation is often also referred to as as design innovation. So taking principles of design thinking that are implicit in the entrepreneurial and technology world, the idea of first starting with a given issue and deconstructing it to identify the problem, the core problem at hand, not just assuming that you have a solution that you're going to apply to an issue without really taking time to understand the problem. And then building iteratively from there a solution that can meet that need or that can address that problem. From there, piloting it, testing it, and eventually implementing it and scaling it at large. And we've seen fantastic examples of healthcare organizations across Canada that have really started to take this structured or design innovation approach, whether it's Orout Health in Quebec, SE in SE Health in Ontario. We're seeing many different examples, including Alberta Health Services as well, that has developed a very well-established pipeline of both innovations that can be tested as well as services. Lastly, architectural innovation is a strategy for innovation that we've seen, both architectural innovation in terms of de novo physical builds as well as data hubs and so forth. In terms of architectural innovation, when we think of what that means, typically it means taking component parts and putting it together in a particular way, whether you're talking about a technology, whether you're talking about a data set, whether you're talking about physical infrastructure. We've seen some really exciting examples of that across Canada. For example, looking at the health technology district in Surrey, a really innovative example of how real estate developers can collaborate with an innovation ecosystem to provide value. That initiative set up a large hub of innovators, of entrepreneurs, of researchers, of clinicians, just beside Surrey Memorial, with an aim to really be at close proximity to both the problems as well as then being able to provide solutions that can directly be translated into clinical care. We've also seen examples, for example, St. Paul's Hospital. The new St. Paul's Hospital build in British Columbia is going to be a very exciting example of how a new physical as well as data infrastructure can be created to enhance or essentially create the hospital of the future. The new St. Paul's Hospital build will be on 6 acres, 6 acres of hospital space. There'll be an additional 12 acres for an innovation hub where they're looking to test and prototype and scale various types of technologies. Then, of course, we have Mackenzie Health that over some time had built out an acute care innovation hub within their institution with 17 smart patient rooms, 37 smart beds, allowing them to continually monitor patient movements, patient biometrics in a way that is systematized and offers a seamless flow of information. Tracking allows them to track providers in terms of their location. So we're just seeing an ongoing spread of different types of architectural innovation.
That's great. Thanks. Thanks for the summary. It wasn't really a summary. It was actually a bit of in-depth look into that landscape scan. Simon, one of the points that you made before is that part of our issue is not really the technological innovation, the R&D, but it's more of the adoption side. And we all know that we have this fragmentation across the country. Now, our framework is trying to help some of that by bringing that community together and joining it. But how do you view the steps that are required in order to make that successful?
Well, that's a bit of a loaded question, especially for a civil servant to answer. There was a lot of discussion in the recent campaign on healthcare. I mean, I guess what I would say as a civil servant would be, and this sounds like a bit of bureaucrat speak, I guess, but the incentives matter a lot. Making sure that the structures you build or the objectives you want to achieve, that the underlying kind of motivation for the various parts of the system, and healthcare is a very complicated system, that they're not they're not sort of pulling in the opposite direction. And so it seems to me like, let's take something like digital adoption, and we can even take it out of the healthcare realm for a second. But there has been, as has been noted, there's been a lot of digital. There's been a huge adoption of some of these virtual care models and applications during the pandemic. We've seen exactly the same thing in the small business sector. It has been an area of some concern for governments of all stripes, going back a long time. And indeed, there's been various iterations of programming that stretch back, at least 10, 15 years, to support greater adoption of digital technology by SMEs in particular. And our rates of digital adoption in Canada, in the smaller business sector, certainly, they may be true writ large. I haven't looked at the latest statistics across all sizes of business, but certainly for SMEs, we lag the US in digital adoption. I'm not talking about health, I'm talking about just generally. And what we saw in the pandemic was a massive rush into digital adoption by the business sector. If you look at the charts and everything, I think you can make an argument we've had more digital adoption in the last 2 years than we probably had in the last 15. And that was because the incentives changed. Like if you didn't do it, you go out of business. And so that's a pretty powerful incentive, actually, if you're in business, is that, facing an existential threat. And you just, so the pandemic, as terrible as it's been, was able to achieve, more digital adoption than, many years of efforts, to try to spur this. So the big underlying incentives matter a lot. And so I would say, first piece of advice, without getting into the weeds of my own personal views, would be you got to look at those sorts of things. So if you've got some new digital technology, you have to look at some of the basic things like, if it's going to produce significant savings, do any of the people who have a say in the adoption of that technology, can they capture those savings meaningfully? Or are those savings meaningfully captured by somebody who counts in the decision making? What does it mean for the physicians and other care providers, and and what does it mean for their situation, and so on. I think so issues like fee codes, care models, bundle care as opposed to siloed care, like all that stuff, I think matters quite a bit for the widespread adoption of some of these technologies. And I'm not saying anything that anybody doesn't already know, but it's maybe worth repeating. So I would say, depending on the kind of managerial challenge of reorganizing some of the production to actually capture the full benefits of the technology, if that becomes extremely difficult and very, very challenging to do, then the question might be, are there other areas you can adopt the innovation where the stakes are a little lower? So for example, there are lots of areas that are kind of like, greenfield territory. There's not already a huge existing installed base of activity that you have to reorganize, which in a publicly funded system can be challenging because, there are many stakeholders, and it's, and there's elections every 4 years and so on. So, we mentioned earlier kind of virtual delivery of mental health care. Well, I know things have improved quite a bit in the last number of years, but certainly when I was at Health Canada, that was something governments worried about a bit. The current federal government, the Trudeau government, when they came to office in 2015, they had made this commitment to significantly increase support for mental health, because at the time, something like 3 or 4% of health budgets were going to mental wellness, and we all know it's a big issue. So that's an area where actually there's not a huge existing kind of playing field that you have to enter into. You may have a chance to kind of build something from the ground up that, takes, that allows you to, kind of take advantage of and exploit some of these new technologies and new management practices. So that would maybe be just, what I would say would be, are there kind of areas of opportunity where you can, uptake some of the innovation and do things differently that, and in the consulting world, they might call that a lighthouse or something, where you're able to kind of demonstrate to everybody, look, you can do things differently and actually everybody wins and so on, and kind of in a way de-risk it for the broader system by actually demonstrating it. And I do think there are, in the pandemic itself, again, as terrible as it is, in some ways may have introduced some opportunities, because clearly, there are areas like pandemic readiness and response where it's obvious that there's going to have to be some thinking about, okay, what do we do for the long term? So that's an area where we're going to be maybe rethinking, or at least spending time thinking about how we organize for that. And then there are issues around, how do you deliver care, better, faster, and maybe more safely in an environment where suddenly the risks of congregating and the risks of kind of infectious diseases are now like been underlined with a big red, grease pencil. And digital is well suited to that. And it's no accident that we've had a massive adoption of kind of virtual care in the pandemic, because it was necessary. So does the pandemic context provide, in a sense, I hate to say opportunity, it sounds like it's a positive or something, but I mean, is it an opportunity to kind of re-examine some of these things? And you see this in the broader business sector with touchless technology and all kinds of automation, in the airline industry and so on. They're thinking about how do they adopt technology to make their systems more resilient, both for now but also for next time.
Thanks, Simon. And Michael, final word to you. There's been, as is mentioned before, lots of changes happening over the past 18 months because of COVID. Do you think there has been a structural change in the mindset and culture of sort of healthcare delivery organizations that will be more open to some of the rapid changes that may persist after the pandemic?
All know the systems are overloaded. We all know that healthcare providers are experiencing burnout. So new ways of doing things more efficiently definitely have got a selling argument. I think the key thing, though, in everything is to really research the market that an entrepreneur or an innovator wants to go into, understand the business case, understand where their technology is providing a benefit. Is it the cost-saving benefit? Is it a new diagnosis or a new drug? Is it an efficiency saving? And is it looking at in existing processes, making them more efficient, or bringing in new processes? And all of those have different complications, as well as the particular segment that you're going for. So in Canada, you've got primary care, we have acute care, we have business that is procured through government organizations directly. So I think as an innovator, you really need to fully understand your market as well as your technology and the business case that you can apply for that to make your customers find it easy to implement and buy your technology.
That's great. Thank you. And we're out of time. I know Suhana, which finally joined, is going to get her hook out and pull us all off. But I really want to thank you generally for participating in this. Again, I want to thank everybody for attending. And I would really implore you, follow that link, tell us about yourselves, join Chic, and make a difference as a community overall. And that's it. Suhana, I guess over to you.
Thank you so much for that, Simon, Aranka, Michael, and Mario. You guys were great. And Mario, you did a great job moderating that panel. We're going to take a quick pause now, give you a chance to check the industry showcase, maybe top up your beverage. Our partners have made this session possible and complimentary for all attendees, and they are available to answer your questions, to talk to you about developments in the industry. I'll just ask you, though, to be sure to meet us back here on the main stage in about 3 minutes, and we will continue with our program. Now, if you missed parts of the presentation or your colleagues are asking, which I certainly hope they will, then the recording for this event will be available by next week. So watch for that wrap-up email in your inbox. And the team at Infoway really appreciates your feedback. It is so important. So take the time, complete the evaluation survey. It is at the right side of the main stage. It allows all the sessions to be more what you want because you've got some input. I want to have a big thank you as well. Applause for all of our sponsors for their support in making this series available. Couldn't have done it without your generous support. So here are the sponsors. And thank you particularly for taking the time to join us, to bring your thoughts. And I hope you walk away feeling inspired. We certainly look forward to seeing you at the final session of this partnership series. It is set for October 19th, and the program for that final series will be shared with you in that wrap-up email. So thank you again. You have a great day, and all of you be well.